Now let's review ectopic pregnancy. So this occurs when a fertilized egg implants outside of the uterus, most often in the fallopian tubes. Now the memory trick here, think double E's. E for ectopic and E for exit. This is where the egg implants outside of the uterus. Risk factors include recurrent STIs, those sexually transmitted infections, like chlamydia, for example, PID, which is pelvic inflammatory disease, and tubal surgeries, which cause damage and scarring, as well as IUDs. Now, Saunders mentions an assessment finding that predisposes the client to an ectopic pregnancy, select all that apply, and this would be the use of fertility medications, history of chlamydia, use of an IUD, and history of PID. Now, in terms of diagnostics, there would be a positive HCG test and an empty uterus upon ultrasound. And as far as signs and symptoms, we would see red vaginal spotting, similar to a period, positive urine pregnancy test, and one-sided lower abdominal pain. Now, as an ectopic pregnancy grows and expands, it may rupture, known as a ruptured ectopic pregnancy. This is a life-threatening issue that can result in major bleeding, resulting in hypovolemic shock. So this is a huge NCLEX tip. The signs and symptoms of a hypovolemic shock would be hypotension, that low blood pressure, tachycardia, a fast heart rate that's over 100 beats per minute, as well as dizziness. And a key finding for that ruptured ectopic pregnancy is shoulder pain. It's normally described as severe, sudden, and sharp. This shoulder pain is from the pooling of blood under the diaphragm. This then pushes the pressure upwards, causing the sharp pain. And this can actually result in peritonitis, which is that deadly infection of the peritoneal cavity. So we see a rigid abdomen, tenderness, and a low-grade fever around 100.4. Now, ATI mentions a client who has an intrauterine device, so that IUD, reports abrupt, sharp, lower abdominal pain and bright red vaginal bleeding. So this would be an ectopic pregnancy. Now, in terms of interventions, we want to monitor the vitals closely for signs of a ruptured ectopic pregnancy. We also want to prepare for a blood transfusion. So you'll want to do that blood type and cross and insert large bore IVs. And finally, we want to prepare for surgery if the tube ruptures. Now, as a little side note, if the tube is not ruptured, we administer methotrexate to dissolve the pregnancy. And lastly, remember that an ectopic pregnancy is never viable and it cannot be transplanted. Now, Hesse mentioned all of these key points in one big question over here. Severe lower left abdominal pain and vaginal spotting. The last menstrual period was 5 weeks ago, and the nurse's next actions would be select all that apply. So we would select to check the results of the HCG test, ask the client to describe the color of the vaginal bleeding, ask the client if she has ever been diagnosed with pelvic inflammatory disease, and finally draw the client's blood for a type and cross match.
All right, that wraps it up. Thank you so much for watching.